With me now is a member of President-elect Biden's COVID-19 Advisory Board, Dr. Michael Osterholm. He is the director of the Center for Infectious Disease Research and Policy at the University of Minnesota. Dr. Osterholm, it has been too long. Glad to have you back. Let's talk about those frontline workers, those healthcare workers that Gabe was just addressing in his story there. Is the Biden team right now trying to address ways to alleviate some of the stress that they are feeling, also to help protect them further as we're seeing more shortages of PPE?
Well, first of all, I can't speak for the Biden team. I'm just a member of the advisory group. I know that this is front and center with the team. We're on their minds 24 hours a day. But as you also realize, without being in charge of the federal government, there's only a limited amount that they can do right now.
Let me get you to respond to something that we've heard now from a number of current administration officials. We heard it from Dr. Giroir the other day on Andrea Mitchell's show. And then this morning, HHS Secretary Alex Azar said this on CBS. Let's watch.
What the American people need to know is the same career people at CDC, FDA, Defense Department, HHS that are running this response in Operation Warp Speed on January 19th are going to be the same people on January 21st, and every aspect of what we do is completely transparent. There's no secret data or knowledge. We've spent hours literally with the public and the media this week laying out every aspect of the distribution planning on these vaccines, our epidemiological information, completely transparent, our planning, everything.
So Secretary
is
Azar,
all out there.
It sounds like you're saying that Joe Biden is incorrect when he says this delay is going to cost lives?
Absolutely incorrect.
So Azar and Giroir yesterday both were saying that the transition, getting Biden up to speed right now, is unnecessary, that all of the information is out there in the public's sector. Do you agree?
I don't agree. And as you know, I'm nonpartisan. I just call balls and strikes as I see them. I, for one, am an example of what's happening right now. Prior to being on this advisory group, I actually had frequent conversations with members of the NIH, the CDC, the FDA, all of these areas in terms of looking towards what can we do, how can we address this pandemic. And since I've been a member of this group, I have not been allowed by law not to speak to these people. This is a big problem. And you can't minimize it by just saying the people who are there now will be there at the end. It's really important that the transition team have access to the kind of information that will allow them to plan now for hitting the ground running on January 20th.
What does the public need to know right now about this process?
Well, I'm not sure what the public can know about the process, other than that I am very confident that this new administration will make science job one. I've seen that already, that this is a very, very critical part of how they will respond. You know, it's about saving lives. Katie, you know, when you look at this situation right now, we're in the most dangerous public health moment since 1918 right now. What we're seeing with the case increases is only going to continue. We're not sure when that curve might ever flatten or how we're going to bring it about flattening it. And so we have to understand that the public is part of the solution here, too. Let's just make that very clear. You know, if you don't swap air, if you distance yourself, basically you are going to do much to help bring this down, whether Washington, D.C. appropriately responds or not.
I know you're apolitical, but and you've been following all of this, and you've been a real straight shooter on all of the issues that we've come to you with. Given everything that has happened, given all of the ways that this president has undercut the public health message, if he came out tomorrow, how much good is it going to do for him to suddenly start supporting social distancing and mask wearing and saying, hey, don't travel for the holidays?
Katie, it's never too late to do the right thing. Never. If that would be done, I think that could help us a lot. You know, while the task force at the White House is surely putting out, I think, a more realistic view of what's happening and why we're in the situation we are, we also recognize, just listening to your previous story, how important the president's words are to so many. Right now, to save lives, it would be very helpful to do the right thing.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.